now have the representatives from Girls Inc. And we're going to go over your proposal, a few things. Then I'm going to have you introduce yourselves. Prior to that, just so you know, it's a 15-minute conversation. I strongly encourage you to talk about your program. If you were to have a cut, how much of a cut you could still be able to run your program with, and obviously the benefits of the program. So Susan, why don't we start with you introducing yourself, and then we'll just go right down the line and then we'll go from there.
Yeah, well, first of all, thank you so much for the opportunity to share presentation. Now it's on. Okay. Well, again, thank you so much for the opportunity to present about our proposal. My name is Suzanne Parker, and I'm the Executive Director for Girls Inc. of the Valley.
Hello, I am Dr. Yadilette Rivera-Colón, Assistant Professor of Biology, Undergraduate Research Coordinator at Bay Path University, and also the Vice Chair of the Board of Girls Inc. of the Valley.
Hi, everybody. My name is Dee Ward, and I'm the Associate Executive Director of Girls Inc. of the Valley.
And I'm Tiffany Espinosa. I am the Executive Director of Professional and Graduate Education at Mount Holyoke College, and I'm also a volunteer with Girls Incorporated and a board member.
Thank you all.
So I'm going to start our presentation, just a little bit of background. Girls Inc. of the Valley has been here in Holyoke for 40 years, and we're actually really excited about that. Our mission is to inspire girls to be strong, smart, and bold. And the primary beneficiaries of this proposal is to serve Holyoke girls, mostly low to moderate income girls throughout Holyoke. We will start with 100 girls in year one, but reaching close to 1,500 girls over the 5-year period. And our program, Together We Will Rise, meets such a significant need. And we're requesting $693,000 for over the 5-year period. We are very adamant and that the amount of funding is absolutely what's needed. But if we look at the first 3 years of funding, it would be just under $400,000. So if the full proposal was not able to be funded, it would make sense for the delivery of the services in a way that is quality to do it in a 3-year period as opposed to a 5-year. We would look to secure other funding to continue it after years 4 and 5. And the need, I just want to talk about, like, even before COVID-19, our staff were observing participants with behaviors with a lot of anxiety and trauma. And I think, if you just Google, childhood trauma and COVID-19, you see the headlines. It's a crisis. It's a real challenge. And so as we've continued programming over the past 18 months throughout the pandemic, we've heard from girls and families the incredible stress, the incredible trauma that they've been facing. Girls that were already facing economic and social challenges before the pandemic. It's only been exacerbated. And the challenge at the same time is access. So how do we make sure that the preventive services, the supportive mental health services that are required to support children to get through this crisis, we can do that as a trusted partner in the community with girls and families for over 40 years. Girls and families trust our staff and trust our team. So we feel that this program will meet those needs. And we know many families in Holyoke have been disproportionately impacted by COVID-19. And we're hearing it from every day. And some of the things that we've been hearing about loneliness, isolation, loss of family members, loss of work, the remote schooling stress. We've heard about from our students increased alcohol and drug use and food insecurity. So these are critical needs that have to be addressed, and Dee gets to talk with you about how our proposal will address those needs.
Yeah, so my role at Girls Inc. is to work with the program team, and when we saw the application for this proposal, we all agreed that mental health was what we wanted to focus on. We have a team of staff, and we also bring in interns every year. And one of the places that we recruit our interns from is from Elms College. And so we met with the head of the social work department before writing this proposal, specifically about how we can envision the way that Girls Inc. staff and interns could support girls at our center and in the schools. And it was felt that really what we needed was a licensed clinical social worker, and the clinical being the key word there. So in order to be a social work intern, to do clinical, they have to be supervised by a licensed clinical social worker. So our proposal is that in the year one, we bring in the licensed clinical social worker as a consultant to work with the staff, to work with interns, and to really start to learn our community, work with the girls, work with our curriculum. We have Girls Inc. identity programs that support social and emotional learning. So to really see how our curriculum can better tie in to the supports that are needed with this clinical mindset, which is where it will really be different for us. And then in year two, it's really making sure that we're in Holyoke Public Schools, that we have teens and elementary school girls coming to our center, and that they are working directly with the staff, the interns, and the licensed social worker overseeing this. So she will really manage this overall mental health component. And then with that, in year 3 and 4 and 5, our hope is that we can bring somebody permanently on staff. That it's there. So the beginning is to create the program, to envision it, to start recruiting, and to really then be able to carry it out for future years. Because as Suzanne said, we know that COVID had a great impact on the mental health of girls. But we know that this is something that just doesn't go away overnight. So really, how can we sustain this and keep our community safe? We know that Girls Inc. girls, when they come to us, being in a pro-girl environment, being with staff that they know from year to year, really creates a space where they're going to be able to have conversations, be able to talk about their experiences in a way that we don't think they're able to do in a school setting, in a mixed gender space. They really can get that with us. So our hope is, our goal is that we're going to be able to partner with schools, partner with the community, and offer this service. And if we get stronger girls who feel confident and comfortable, they're going to affect the community at large, and that's our purpose.
I just want to ask one question. So right now, I mean, if I heard you correctly, I think you're saying we're going to partner with the schools in the second year. Mm-hmm. So I'm assuming there is some outreach to schools at this point?
Already.
Yeah. Mm-hmm. So what our hope with that, again, is by the second year, we're going to have the solid curriculum. So we have right now Girls Inc. identity programs that we do in the Holyoke schools. But we'd like our mental health consultant to really work with us on how to develop these curriculum to be an even stronger curriculum that we can bring in the school. And so that's what we're hoping to build up over time.
Okay, thank you.
Mm-hmm.
And
Right.
Tiffany or Ajadi?
Sure. So I would love to add to the conversation here. So as actually one of the mentors and volunteers with Girls Incorporated, I've worked with the kids, I've worked with the families. And, you know, one of the things that I think is unique about Hampden County is that we have one of the lowest number of mental health care providers in the state. And so working with these kids that are already got a lot of stress in their families, I know that some of the barriers to access are even higher, right? So not only are there not enough providers, but with some of the families, they may not have insurance, the cost, the taking time off to take your kid to try and get them support. And I see how much the families really want to support their kids. And so being able to have support on site, either at their school or through Girls Incorporated, would be an enormous benefit. Of course, directly to the children, but actually to the families, right? This is how we are able to keep people at work. This is how we're able to reduce the stress and anxiety of parents, and actually some of the challenges of employers. I know as an employer, we see this, and we actually work with a lot of the schools regionally and a lot of the caregivers. And so I think there's a broad systemic effect here with particularly this work. The other piece is that, especially when it comes to mental health care, families want to have a high level of trust that whoever's providing the care really understands the context. And when you're talking about kids in poverty, when you're talking about minoritized children, the trust issues about who is this provider, do they really understand what's going on, are really high. And sometimes that can make all the difference between seeking help and not seeking help. And so I think the fact that this is an embedded program that's been in the community and it for decades. Literally, some of the parents that I've met went through the program when they were kids. And so I think that this has a broader systemic effect that is really important for our community. And I'm looking at it really, of course, with the kids, because I'm worried about them. I see them. But families, employers, and even people's ability to be civically engaged. So, thank you.
Thank you.
When you break a leg, you go to the doctor, and that doesn't faze anybody, right? When you have a trauma or something that is mentally related, there's so much stigma. And that's passed down from families to the girls, and it's hard. When something is truly bothering you and it's a mental health issue, it's hard to find who you are talking to, who are you gonna seek help from, and how is it that you're gonna get the care that you need for. Imagine having a problem like that and being a girl or a teenager. How do you access those resources? Who do you talk to? Who do you feel comfortable with? Especially in the teenage years where it's so hard to trust anybody. Being able to have the Girls Inc. of the Valley offer these services breaks down some of the barriers. Part of it being the fact that they have people that they already trust, and they will be able to bring those resources that they learn for their own mental health to their families in a way that they will actually trust. Because it's not, I went to a therapist and the therapist told me. It's, as part of this programming with the people that I trust and work with, I've learned these coping strategies. I've learned to do X, Y, Z. And they do it with little things already that they learn in the different programs. So imagine if they can actually do that with mental health. Right now, just before I came here, I ran from teaching a class for Girls Inc. And these were girls who were young women at this point who are getting into college. And one of the things that I made sure that they knew was how to find mental health services at the colleges that they applied to. But it would be important if they already knew how to use those services and be really versed in how to get their needs fully met. And I think that we have a great opportunity here, and you guys have the opportunity to move the needle forward in order to make mental health something that people can talk about their houses and not feel like, somebody's saying I'm crazy, but mostly that it's part of your overall health. So I really support this, and I hope that we could get it.
Okay, thank you all. Let me ask, so the age bracket for your membership is?
We serve girls 5 to 18.
5 to 18. And I think you said this program primarily for the first year was 100?
Yeah, the first year, again, as Dee explained, we're very intentional about planning and doing a high quality delivery of any program that we're going to offer. And so the first year will be partnering closely with the licensed clinical social worker, looking at integrating the integrums. We are working with girls now. Right. I just want to be clear about that. We already have established partnerships. We're already reaching families who've been doing that for 40 years. So it's really that intentionality in year one where we know at least 100 of the girls that we're going to work with in Holyoke will be more immediate beneficiaries of this intentional programming. In year two, and I probably should have brought, I think it scales up incrementally. Yeah. By year 3, we're at 400 girls. So again, we're strategic about it and thinking about how we roll this out, how we make sure the staff have the training and the supports and the intentional mental health supports that are needed. Again, as Jadi said so eloquently, we have the trust of the families. And so we don't want to do anything to violate that trust. So if we're going to provide supports in this area of social emotional learning, boy, we're going to do it really, really well to make sure that the solution and the supports are meeting the need, right? So we're confident in our ability to carry this out. It's been something that even before COVID-19, we've been saying, oh my gosh, we've really got to wrap our arms around this. We've really got to be more intentional about it. This provides an opportunity for us to make that happen. And I think the way we're doing it is to create a sustainable model that once ARPA funds go away, right? We know this is sort of a one-time opportunity, that we're looking at a sustainable model over time. It's going to empower our organization to get better at this, to provide the needs for girls, to see what this model looks like so we can sustain it in the long term, because we know it's key, it's critical.
Okay, and one last question about the age bracket. I'll show some ignorance here, but that's okay. So in the first year, are we targeting a specific age group, or is it teenagers? Where is the greatest impact in terms of the
In the
youth?
first year? Yeah.
In the first year, it is upper elementary and lower middle school. So we're really looking at like 4th to sort of 6th, 7th grade. So
Okay.
sort of the
So something
two.
like 10 to 13 or 10 to 14?
Yeah,
or something?
probably a little bit more, probably like 9 to 12 is
Okay.
sort of the focus for the first
Okay.
year.
Okay.
And the data on the impacts of COVID on this age group is undeniable. I mean, these are kids that COVID has absolutely ravaged. So I think this is an important moment for them too.
Okay, you probably saw the sign going up that said, wrap it up. So first of all, I want to do a few things. I want to thank you for all you've done over the years. I want to thank you for the proposal. We're going to try to do our best to try to make sure we get as many benefits to as many people as possible. You probably have heard I've got $99 million of requests for $13 million, so I'm trying to figure out how do I take as many things, make sure they're effective, but also try to make sure I get them spread in as many parts of the community to make a difference. But I want to thank you for the proposal. I want to thank you for what you've done over the years, and I would hope that we're going to be able to make some decisions. My hope is at the latest mid-September. I'm hoping to make them faster, but I got to go through a process here. So, all right, thank you very much. Appreciate your time. If you can make sure the green lights go off, that would be great. And good luck, and thank you very much.
Thank you.
Thank you very much.